Welcome, everyone. This is Marilee Tolan, and welcome to my interview show, where I interview experts in the fields of health and wellness, essential oil, self-improvement, self-healing, self-empowerment, and entrepreneurship. Many of you who have been listening in on my show for years used to know me by Green Tea with Marilee. Now I'm transferring over to Marilee.tv. And most of my interviews these days are online video. Tonight is going to be an audio interview, and that is simply because of some recent Google glitches and Google Plus and Hangouts. And I actually have to say I'm slightly disappointed if we're audio and not video tonight, because our presenter is not only just beautiful on the inside and with the work she's doing in the world, but beautiful on the outside. I'm sure many of you have seen her pictures. We will have a little bit of time for questions at the end of the presentation. So let me just tell you a little bit about our presenter and who I'm going to interview this evening. Anita Brikman is the Senior Vice President of Communications for National Hospice and Palliative Care Organization. Anita is a former medical reporter and news anchor for ABC in Philadelphia. So for me personally, I've known about Anita Brikman for many, many years. She was in our living rooms in the Philadelphia area during news time, or in our kitchens at dinner time with a newscast coming on, and she was really sharing some great information as a medical reporter, and then became a news anchor for ABC as well. Currently, she is working on a campaign which I'm going to be asking her about tonight, having to do with end-of-life care and national hospice and palliative care, called Moments of Life Made Possible by Hospice. Anita, thank you so much for taking your time to be with us this evening.
Oh, Marilee, it is such a pleasure, and it was so great seeing you when I was back in the Philadelphia area in South Jersey, because it really is one of the most robust and committed local news markets. And it's great to be working on the national stage, but I'll never forget the experiences I had at Action News and in Philadelphia. I moved on from that to become a news anchor in Washington, D.C. as well, and then transitioned into the position I'm in now with the National Hospice and Palliative Care Organization.
That is very, very exciting. And I have for the people who are local in the Philadelphia and South Jersey area, I have a nice relationship with Samaritan Hospice, who put together this event where I ran into Anita Brikman. I was so excited to see her name, Anita's name, on the bill for the presentation that day. And because of my passion also in end-of-life care, and then knowing you from before, Anita, it was just such a great pleasure to see the work that you are doing now, which I know you're going to share with us tonight and talk about. And it is just something that is so important, that your messages that you are getting out about hospice and about palliative care, it is such a gift, I feel, that you're bringing to the world at large, because this is such a tender part of life, and so much wonderful things can happen, and you're really setting the stage for people to learn about this. So tell us a little bit about your work with NHPCO and the national campaign.
Well, so basically, NHPCO represents hospice and palliative care providers around the country. About 60,000 individual members who are doing this kind of work around the nation. We are a membership organization, but part of the reason they brought me on was to let people know that hospice is available. And this is not just brink of death care. It's not at the point where there's nothing left to do, there's only days or hours remaining. People access hospice and palliative care way too late. And in fact, it's so interesting, Marilee. Just now I was at an event and talking to a gentleman, and when he heard what I was doing, he said, "Oh, I just so wish we had taken advantage of hospice. We were so insistent. My mother stay in the hospital, stay in the ICU, and that is where she died." And to this day, you know, my siblings and I are sad about this, because our rabbi, this gentleman said to me, told us, take your mother home. Hospice can help you do that. And they were too worried about what that would be like. Hospice allows people to have special moments with their family and friends in the setting where they want to be, not necessarily focus on curative treatment anymore, but comfort care, free of pain. This is the idea that we're trying to allow people to understand, and it is so. There is a hospice Medicare benefit. So many people also think they can't afford this help, and that's just simply not true. The national campaign is all about letting the public see that if people make a choice to bring in hospice and palliative care, what they are choosing is quality of life when there's precious little of it left.
Mm. Oh my gosh, that is just so wonderful. You know, I've been kind of on a personal campaign myself for many, many years. Even though I'm doing this work now with my interview show and many things online, I have a background as a registered nurse, and I was in the ICU for many years. And I made a promise to myself that I would do whatever I could do to keep my parents out of that situation at the end of their life. So I had a little know-how going into our situation with both Dad and Mom. Dad was the one to pass first, and this is where my relationship with Samaritan started. But I just want to say that I had that awareness that it's, and here's a line that I like to use, it's never too early to call in hospice many times, right? So we had the most beautiful 9 months with my father on hospice.
9 months. I mean, that just says it right there, Marilee. And you as a healthcare provider, someone who was a clinician, saw firsthand how that could work.
Yes, it was beautiful. I mean, the family, so much healing takes place at this time, right? So the family, got together and was able to say to each other what we needed to. And these moments of life that you share with the videos that you have, I got so inspired that day because I just felt so blessed I was able to have that with my father, and I thought, oh my gosh, here is a big campaign that can tell other people about it as well. And I'm just so excited about what you're doing.
Well, that really is a great segue, because here we are speaking on Veterans Day, and the video I showed, Marilee, as you know, really focused on a veteran. It's called Don's Honor Flight, and all of our Moments of Life videos are at momentsoflife.org, www.momentsoflife.org, and Don's trip to Washington, D.C. on Honor Flight was made possible by his hospice. He was from Billings, Montana, and was very concerned about trying to make this trip. He was a World War II veteran. He had severe COPD, and he was worried about breathing. His hospice team made sure his oxygen was exactly calibrated. They made sure the arrangements were there for the trip so that he and his son could come to Washington, D.C., experience these monuments together one more time. And Don actually passed away within hours after returning home. Now, obviously, that doesn't happen for most people where there's such a momentous trip or something like that ahead of that time. But what our campaign is about is saying, it can be a moment that's big like Don's, or it can be so simple as a family dinner. And we have a cancer patient profiled out of Buffalo. The story is called Moments of Grace. You simply see him not in an ICU, not surrounded by machines, but there's a hospital bed in the living room. His grandchildren are running around. They're playing with glow sticks and an iPad, and then they all sit down to dinner and say grace. It can be moments big or small, but bringing in hospice earlier rather than later, as you did, Marilee, it really makes a difference for people.
So what is it exactly that the Moments of Life are about? I mean, I know I heard you speak about different things like what you just shared, this story, this gentleman took a trip. Is there an encouragement for people to fulfill some of their dreams at the end? Is it something that is provided for to take these trips, or it's just the education?
It is twofold. First of all, many hospices do try to grant last wishes for people. And even our National Hospice Foundation does this as well on the national level to try to help, they call it the lighthouse, to try to help people fulfill last wishes. But that's not the only part of this. Momentsoflife.org not only has the videos that show what people experience in hospice, it helps them find their local hospice. There is a decision tool called What Are My Options to help you decide where you are in dealing with a chronic illness. The other thing that we think is so important is for people to understand palliative care. Palliative care is all about easing of suffering. It is not limited just to hospice when you have kind of foregone curative treatments at the very end of life. A palliative care consult or specialist can help someone really control any kind of residual pain or other issues that are very challenging to them. So you could be getting your cancer treatment and also get a palliative care consult to make sure that holistically you're being taken care of. The whole point of this campaign is to look at this as a trajectory, as a continuum. We want people to start thinking about what they want at the end of life, whenever that may come. Really communicate that to family members. Fill out your advance directives. Have a conversation about what you want. It's not that it's going to be imminent tomorrow or in a week or 6 months from now, but if you have that conversation ahead and express what it is that you want in your final days, there is a much greater chance that you will be able to experience that. So that's what the campaign is about. It is inspirational in the sense of sharing these video vignettes that people can watch, but it's also educational. They can go on there and learn about hospice and palliative care, and they can also find hospices in their own community who might be able to give them some help.
That is wonderful. Wouldn't it be exciting if they could switch the advance directive forms now to like ask some questions like this that you know when you come to think about it, everybody's afraid to fill those forms out, right? But if they had something like what are the moments of life that you would like to have besides, turn off my ventilator if I'm in this condition, right? I mean, it's like a whole paradigm shift that you're creating.
Well, it is, and it's interesting. The Institute of Medicine has just issued a new report called Dying in America, and their whole point is that, it's not just about the dying process. We have a chance, if we take advantage of it, to really shape what we want in all of our healthcare settings. And it's not to end up at the very end in an ICU when those treatments are no longer effective. That doesn't serve anyone, and you've obviously seen that as a nurse. The other thing I think is so important to stress is that hospice care is holistic. It's very much patient-centered, family-centered to make sure that you are taken care of, not just as far as physical needs, but psychosocial as well. I mean, is the caregiver okay? The one thing that I do need to stress about hospice care, it's not like you have a whole team that comes in that's there 24/7. They are available to you, but the family member, the wife, the daughter, whoever it might be, the son, is also a primary caregiver in this setting. So hospice helps a family bring their loved one home or can also help in assisted living, a nursing home setting. So it is a support system, but it's very much centered on helping the family be the caregivers for the individual, not necessarily like you're turning care over to someone else. That's a myth about hospice, or that you have to go somewhere away from home to get hospice. That's just simply not the case. The family helps care for their loved one, and that's one of the biggest gifts I think that we can give each other.
Yes. Oh, indeed. I've got to give a little plug for Samaritan once again here. So we utilized in our family Samaritan Hospice for when Dad passed. He was the first, and then after that it was Mom who had kidney cancer, and we had them both here at home, and again had just wonderful care from hospice care from Samaritan. And that when it was Mom's turn to go through this part of her life, Samaritan had in place a complimentary care department, and the primary caregivers were entitled to massages themselves. So
that's
was
amazing, isn't that? I mean, that's really
experience.
Very holistic.
Yes, it was just absolutely wonderful. I heard a line that you used that I wrote down, and I just love it so much. I'm going to borrow it, always giving you credit, but here it is. It's relating to what hospice and what your movement is allowing here with this national campaign. More moments instead of more medical interventions. And I think that's really what a lot of people want at that time. And, it brings to mind again, and I know I'm just interjecting some of my personal stories because just to demonstrate each and every one of us all have our own as well. But I can validate a lot of what you're saying from personal experience and also being on the professional end of things. When Mom came home from University of Penn with her end of, her terminal diagnosis of kidney cancer, she had better pain management in the home. She was actually able to access a certain level of pain management that she wasn't even able to access in the hospital, which was a self-directed pain management system. And they said, oh, well, once you leave and you're on hospice at home, then you'll be able to have this. And it was just so amazing how many wonderful things that were available in the hospice setting outside of the acute care setting.
That is so true, Marilee, and people really don't realize that. I think they worry that when they're choosing hospice, they're giving up in some way. They're giving up access to their medical team. Their doctor can stay very much involved once a person chooses hospice, or the hospice physician can oversee the care as well. And these are experts in pain management. That's what they do, and also in making sure that the family is stabilized. We do see, it's interesting, I mentioned this Institute of Medicine report. We looked at studies that show people who are getting hospice or palliative care with the same disease kind of state actually do better than people who may be in an acute setting. They may actually live longer, which is what people don't understand. I mean, that goes against the grain of what you would think it would be. But in fact, they may do better because they're in the home setting, their pain is controlled, and there's a team that's checking in constantly. So if there is a problem, you can go to a hospice facility if it feels like things are getting out of control, a family is not able to manage. And what you're not doing is going back into the hospital. Repeat hospitalizations are not good for anyone, as you know, Marilee. It's not good for the family or the patient, and it's certainly not what our healthcare system should be providing folks. We need to do better than we are right now in integrating care, and hospice has been about that for many years. And we just want to spread the word that that is available to people, especially in the United States, where we have a hospice Medicare benefit. And there's also something called concurrent care that I just want to briefly talk about, especially in pediatrics. As you can imagine, this can be just such a devastating time for a family if a child is critically ill, is facing a potentially terminal situation. Concurrent care under Obamacare, under the Affordable Care Act, is now the law. That means that if a physician certifies that if the disease would take its typical trajectory, death could be possible within 6 months, the family can access hospice care. So even as curative treatments continue for cancer or whatever illness is that child is facing, hospice can also step in and help support the family and, again, deliver the kind of holistic, patient-centered care we've been talking about in the home versus having that child go back in the hospital, where obviously it's not good for anyone.
Mm-hmm. And that was is that specifically for pediatrics, you were saying? The concurrent
right
care?
now it is the law in the pediatric population under the Affordable Care Act, but test models are being tried in adults as well, where there are test models of this concurrent care idea. And some private insurance companies have already gone to this, where they say to their patients, you know what, we'll give you a consult with this hospice team. No one's saying you have to stop treatment at this point, but at least you know what your options are. And really, personally, I believe that's where we need to move in the future, is to make this more of a continuum where people can access this kind of care that helps them stay at home at a very difficult and tenuous time, but also a time, like you said, where families have emotional leave-taking and making amends and all those things that we want to do that are so much easier to handle in a home setting. I mean, we've medicalized the death experience so much. I mean, one of the big champions of hospice talks about, the home birth has really kind of resumed as a movement. Why don't we try to do that at the end of life as well to make that transition less medical?
Yes, absolutely. Well, we have, in terms of our listeners here, probably two groups. Healthcare professionals, I know there are several who are on the line and listening in and will be listening to the replay, and then those who are interested for their own personal information for their family or themselves just to have, or maybe some of them are in the throes of this. What kind of information could you give, I guess, number one, to the healthcare professional to help them spread the word about your movement and what you're doing, and then secondarily, another question would be, what could you say to those people who are wanting to learn for themselves more about this?
Well, for the healthcare professional, what has become very evident in some of the research or even some of the surveys that NHPCO has done is that many times people are waiting for their clinician, their primary care physician, their nurse practitioner, whoever it is that they're dealing with, or sometimes their critical care specialist or their disease-related specialist to say, you know what, we're running out of options here. These treatments don't seem to be working like they were at one point. We need to prepare for this transition. People are waiting for their healthcare provider to bring it up, and we have heard that many times healthcare providers are reticent to bring it up because they feel like the patient is going to feel let down or that they're giving up on them. So now you've got a patient who may be looking for that conversation to come from the doctor, and the doctor waiting for the patient to initiate it. That we have to change. I spoke with a community oncologist recently who said whenever he deals with metastatic cancer cases, he begins the conversation with his patient saying, we're going to do everything possible. We're going to give you every chemotherapy and other modality we have to try to control this, to try to beat this. But at some point, there may very well come a time when we're out of options. And I want to tell you now, someday I may have that conversation with you, and I want you to start thinking about that. He has found that starting that so much earlier in the process actually brings relief to some of his patients. He talked to me about a woman with breast cancer who he had treated for 6 years. And finally, she came in and he said, I'd really like you to bring your husband with you and have a conversation. And she got there and she said, oh, doctor, is today the day you were talking about? And he said, yes, today is the day. Today is the day where I don't have any more options. But the fact that she had heard that literally years before helped ease the transition. So I think what I would say for a healthcare provider is to feel comfortable to have these kind of conversations. Your patient may be waiting for you to say something if that is in fact what is happening. I also understand that how incredibly taxed and busy our doctors and other providers are, and it's you can't have this conversation in a rushed visit when you've got 10, 15 minutes. That can't be the case. So we need to change some of that, and that's the other Institute of Medicine recommendation is that that physicians and other providers be compensated for their time in helping shape end-of-life care. Now, when it comes to the person who may be looking for help, I would highly suggest 2 online resources we have. One is momentsoflife.org, momentsoflife.org, where there's a lot of information, the inspirational videos we talked about, and a way to connect with a local hospice provider. We also have a site called Caring Connections, and that web URL is caringinfo.org, caringinfo.org. There's a ton of information there about advance directives, very state-specific, what needs to happen legally in each state. There are resources as far as pain control. There are resources as far as caregiving. So, and there are also, there's also information that might help a person assess their own situation. Both momentsoflife.org and caringinfo.org could be resources for someone exploring their care pattern. And I think that one other thing I would say, Marilee, to people is please don't be afraid to bring this up to your physician. Don't be afraid to have a conversation about what you want, because your doctor may not know all of the aspects of that, and we have to speak up and be champions for ourselves throughout our life and throughout our healthcare journey.
Mm-hmm. Excuse me. So some of the videos I know you played that day that we were at the presentation here in this area, and they were just so wonderful and so inspiring, and stories just make such an impact on our life. Do you think it would be a good idea to have a patient, like say you have a hospice nurse who is in that discussion, or maybe with somebody who's not in hospice yet, or maybe they are in hospice yet. Do you think these videos would be appropriate for the patients to watch and get inspired or get some ideas?
Oh, absolutely. And there's one that was just added even since the visit I had with you, Marilee. It's called Finishing Strong. I mean, what a title! But it's a former NFL player. He is in the Houston area. Through a series of all kinds of treatments for his cancer, and then decided, it wasn't working. He was so sick from the chemotherapy and radiation, and he decided, I'm going to finish strong in the sense of I'm going to define what I want. This is my time, care on my terms. And that is, I would encourage people to look at that video almost more than any other, because what he talks about, he says, this is my timeless time. I don't know when the end of my life will come, but right now I am living every moment to the fullest, as opposed to being ill from treatment that my doctors have said are helping me. So I think the videos can be very inspiring. We have a story, Baby Amanda, a family who was able to bring their little girl home. Like I said, Don's Honor Flight is one of our most viewed videos. And then there's the other part that I want to bring up, that what hospice does. Hospice helps with the process of dying for the family, and then is available for bereavement help for up to a year after a person passes away. So we have a video here called Grief Child's Eyes, and it's filmed at Camp Aloha in Savannah, Georgia, where children have gone to a grief camp sponsored by that hospice. Their loved one may not have even been in hospice. This is something else that hospices like Samaritan and others around the country, like the one in Savannah, do for their communities. They offer grief support. There are support groups for adults. There are support groups for children to help with the grieving process. And so, yes, I would really encourage people to just take a look at some of these videos and start thinking, wherever you are in your life, think about, is this what I want? What do I want at the end of my life? Having that conversation earlier, having the chance to explore it before you're at a crisis, can make a very big difference to family and friends as well.
That is just so wonderful. So are you getting a lot of activity and hits on these views from probably all over the world? I know you're speaking specifically about what we have here available in this country, but I'm sure you're having an impact and influence globally as well.
Well, we really are very proud of the fact that so many of our hospices who are members of NHPCO also are global partners. We have an organization called Global Partners in Care. It began in Africa but has now expanded to India and is going global, where hospices in the United States partner with hospices and palliative care providers in areas of desperate need and become their partners, so to speak, across the globe, and help fund what they need, whether it's, in one case, hospices in Africa were asking for bicycles so that their healthcare workers could get get to them much more easily than walking. These kind of things, these partnerships can make a huge difference globally. We are also in touch with palliative care providers in the UK, in Canada, in Africa, in Malaysia, everywhere, to talk about the need for palliative care, meaning the easing of suffering. We are so fortunate here in the United States, Marilee, as you know, that we really do have ready access to pain control as far as morphine and other medications. That is not the case in many parts of the developing world, and people suffer needlessly. So that is another thing that NHPCO champions, is the easing of suffering around the world.
Oh, my gosh, how wonderful is that? What is the website, Anita, for the Global Partners in Care?
It is globalpartnersincare.org. So
Okay.
people can take a look at that. Yes, it is wonderful. And then the other thing that I do want to bring up is that we have the We Honor Veterans program. So as some of our hospices are doing work globally, others are really part of our We Honor Veterans Network, a partnership with the Veterans Administration about making sure veterans are honored and cared for appropriately at the end of life. So We Honor Veterans is another program that NHP champions. It's just such a neat part of my job, Marilee, because we really do have some wonderful programs that we make available in the United States and around the world.
Oh, my gosh, how wonderful. Well, it was just so generous of you to spend your time this evening to share with us all this great information, wonderful resources, and definitely inspiration. As I'm looking on, I think we have 2 questions that came in.
Great.
Let's see. Okay. Home Death, Marianne from Marlborough, New Hampshire, writes in, home death is loving care and personal empowerment, to be in control of their pain management, to be able to let go with dignity. I'm going to let my daughter know this. I'm very well, doing 3 jobs. She knows this is vital for me to live longer. So you inspired somebody to finish strong. She said, I want to finish strong. And then, okay, and another question came in. Please repeat the name of the website that has the children's camp video. So why don't we just go over the websites again one more time?
Let's do that. momentsoflife.org. Just one, it just is continuous. So www.momentsoflife.org. And the videos are all there on the homepage, including the one called Grief Through a Child's Eyes. There is also a section on that website about grief and loss and some resources that help someone who may be coping with loss. So that is another part of momentsoflife.org. That's where the grief video is, and so many of the others, and the resources, including finding a hospice provider in your own neighborhood, wherever you may be, and whether you're looking at hospice services for yourself, a family member, or in need of their grief and bereavement help. The other website I think that is really important for folks is caringinfo.org. caringinfo.org. There are advanced directives state by state, information for family caregivers. There's a host of very consumer-oriented informational pieces that may be very, very helpful to folks. So I would hope that people really check both. But momentsoflife.org also has links to Caring Connection. So I would encourage your listeners to please start there.
Wonderful. And then that last one in terms of the global partners is globalpartnersincare.org. Was that correct?
And that's just it, Marilee. I would have to say that I would have to go back and take a look, because I think it could also be GPI. So I would encourage folks
you know what? They could just
Google
Global
it. Partners in Care.
Yes. Thank goodness for Google.
Please use Google for that one. I should have been better prepared for that question.
Right. No, that's good though.
Because
this is wonderful.
Providers who are doing great work around the world as well.
Yes, right. Well, Anita, again, thank you so very much for your time this evening and letting this community know about these wonderful resources. And we're going to make this replay available for folks and send some emails out about it so that they can listen to for those people who were not able to join us live this evening. And then is there a way that anyone can follow your work or your part of this whole campaign? So if we follow the campaign, we follow your work and vice versa?
Absolutely. Please follow me on Twitter. I'm at Anita Brikman. It's ANITABRIKMAN, and also NHPCO. NHPCO News is on Twitter as well, and we are tweeting about the campaign. We had a wonderful social media push, Marilee, this Friday with our hospices. It was called Take a Moment, Make a Moment. We have a Share Your Story gallery where all of these amazing photos came to you.
Anita, I'm so sorry to say you've been going in and out for the past bit here. It was kind of like the underwater sound, and I'm afraid you might have disappeared. Are you there? Okay, I think we lost you, unfortunately. I will repeat what I thought I heard Anita saying at the end, to follow her on Twitter at AskAnitaBrikman, and then talking also about a social media campaign and push this coming week. You know, this is, and I did fail to say this in the beginning of the call, but you know, we're bringing this information out because November is National Hospice Month, and so we felt that it was very appropriate to have this topic available and a wonderful spokesperson for this movement nationally on the show, and unfortunately we lost the connection with her. But thank you everyone for taking your time and either being with us live here tonight or who is listening to the recording. This is such a wonderful movement to be a part of and to share with either your loved one, other family members, if you're a healthcare professional, to bring this out to other healthcare professionals so we can collectively make some changes and have a great impact on this very tender time of life, which is that end of care. So again, thank you all. Thank you, Anita, if you are hearing us, but we can't hear you. And have a good night, everyone, and happy National Hospice Month. Take care, all. Yes, you can listen to the recording and see all the recordings of the interviews at marilee.tv, Marilee.tv. Good night, everyone.